If you've been told that type 2 diabetes is a permanent, progressive sentence, that the only option is more medication, medical science tells a different story. In the landmark DiRECT ReTUNE trial, between 46% and 70% of participants achieved not managed, not controlled remission. Traditional treatment chases the symptom, forcing glucose out of your blood with medication, never touching the cause, deep cellular insulin resistance and chronic hyperinsulinemia. Reversing that cause? It's not extreme. It's about basic daily biology, done consistently. Here are 7 evidence-based habits that drain organ fat and rebuild insulin sensitivity. Close your eating window by 7 p.m. Your metabolism runs on a strict 24-hour clock, your circadian rhythm, and most people never get told about nighttime resistance. As daylight fades, your brain releases melatonin. Melatonin tells your pancreas, slow down insulin production. So eating a heavy, carb-loaded dinner at 9 p.m. is a disaster. Stop eating 3 to 4 hours before bed. This gives you a clean overnight fasting window where insulin drops and your body flips into fat-burning mode while you sleep. Your liver starts tapping into stored fat around your organs, and you are literally losing organ fat while unconscious. Walk 10 to 15 minutes after your largest meal. Normally, insulin is the key that unlocks your cells for glucose, but your muscles have a secret backup door. GLUT4. The moment your muscles contract, walking, climbing stairs, or squatting, those transporters rush to the cell surface, pulling glucose straight from blood. A 10 to 15-minute brisk walk right after your largest meal can blunt your post-meal blood sugar spike by 30%. Bad weather outside? No excuse. Indoor marches, calf raises, or climbing stairs trigger the exact same GLUT4 pathway and effect. Habit 3. Fiber first, protein second, carbs last. This one costs you $0 and takes 0 extra time. Eat carbs first, and glucose floods your bloodstream fast. But flip the order, fiber first, protein second, carbs last. Chemistry changes. Soluble fiber forms a thick, gel-like barrier along your gut lining, which physically slows down how fast glucose gets absorbed. Studies show this sequencing trick flattens post-meal blood sugar curves by up to 73%, while triggering satiety hormones like GLP-1. Salad first, protein second, rice or bread last. Every single meal. Now, habit 4, 2 full-body resistance sessions a week. After a meal, over 80% of the glucose in your bloodstream gets absorbed and stored inside your muscle tissue. Starting around age 30, you lose 3 to 8% of muscle mass every decade if you don't actively fight it. That loss is called sarcopenia, and a smaller muscle tank means sugar sits in your blood longer with nowhere to go. 2 30-minute sessions a week, squats, rows, presses, or bodyweight exercises is enough to expand that tank and rebuild insulin sensitivity. Habit 5. 2 supplements with real clinical backing. I want to be clear. No supplement ever replaces real whole food. First, berberine, 500 to 600 milligrams taken right before your main meals. Berberine activates AMPK, your cell's master metabolic switch. Flip that switch, and your liver makes less new sugar while your muscles absorb more glucose, lowering fasting blood sugar and A1C. Multiple randomized trials show berberine lowers fasting blood sugar at levels comparable to early pharmaceutical drugs. That is real data. Second, magnesium glycinate, 200 to 300 milligrams before bed. Up to 48% of people with type 2 diabetes are magnesium deficient. Magnesium is a required cofactor for the enzyme that lets your insulin receptors change shape and accept glucose into the cell. No magnesium means no shape change and no glucose uptake. Now, habit 6. Track your HOMA-IR, not just fasting glucose. This is the habit almost nobody knows about, and it might be the most important single habit on this list. Your fasting glucose can look completely normal for 10 to 15 years, while your pancreas silently works overtime, producing excess insulin. That hidden state is called hyperinsulinemia, and it damages your blood vessels long before your A1C ever crosses into diabetes. So ask your doctor for one extra blood test, fasting insulin, alongside your standard fasting glucose test at your checkup. Then do the simple math yourself. HOMA-IR equals fasting glucose times fasting insulin, divided by 405. A score under 1.0 means excellent insulin sensitivity. A score above 1.9 reveals early hidden insulin resistance happening right now. This single calculation catches the problem years before a standard test flags it, giving you plenty of time to act. Now, habit 7. Hit 30 to 35 grams of fiber every single day, no exceptions. A major review in the World Journal of Diabetes, pooling 26 clinical trials, found hitting 35 grams produced massive A1C drops. Fiber works two ways. Up top, it slows carbohydrate absorption. Down in your colon, it feeds your beneficial gut bacteria. Gut bacteria feed on soluble fiber, producing short-chain fatty acids like butyrate that repair insulin receptor signaling at cellular levels. Getting 35 grams daily is easy. 2 tablespoons chia seeds, 1 cup lentils, and a cup of blackberries hits target. Before making these daily habits changes, here is a critical safety warning if you currently take prescription blood sugar-lowering medications. If on insulin or sulfonylureas, consult your prescribing doctor first. As blood sugar drops naturally, medication dosages must decrease. If dosages aren't adjusted downward by your physician as sensitivity returns, you risk experiencing dangerously low blood sugar events. Avoid the dirty keto trap. Cutting carbs while consuming processed deli meats and seed oils, PROS, worsens cellular insulin resistance. Stick to whole foods, lean protein, wild fish, non-starchy vegetables, legumes, nuts, seeds, and healthy natural fats every day. 7 evidence-based daily habits to drain organ fat, optimize HOMA-IR scores, and rebuild real long-term cellular insulin sensitivity. If this video helped you, hit like, subscribe to HealthToDo, and comment below which habit you're starting today. Thank you for watching HealthToDo.